And welcome back. I'm Mabel, Jong. You're watching continuing coverage of the World Healthcare Congress coming to you from Washington, D.C. We're going to talk about climate change, and from a very interesting point of view, from the point of view of a physician. Dr. Imelda Dacones is here, and it's so great to see you again, Dr. Dacones.
Thank you for having me.
Well, I do think it's very interesting to talk about climate change from a healthcare perspective, because we hear about it a lot from the big picture point of view, that it's happening in someone else's neighborhood, it's happening overseas, or with the ocean, with plastic in the ocean and all of that. But Dr. Dacones, you think this is a very personal issue. Why is that?
Yes. So already the World Health Organization accounts for 150,000 lives lost every year because of climate change. Now, if we take it to our neighborhood, so you and I came from the West Coast. On the West Coast, the climate change has really impacted seasonal changes. We have longer fire seasons, more intense fire seasons. So if you recall the Camp Fire November 28 in California, you know, that killed 84 people. It burned 14,000 homes, displacing 4,000 families. So think about the health about those families and people impacted, displaced from their homes. You and I know about homelessness, the impact of that. For children, the trauma, the adverse childhood experiences that can linger and last for the lifetime, leading to mental health illness. So when you think about our country already being stressed by mental health resources being so scarce and only going to be more scarce with physician shortage, that takes a toll. So mental health, displacement, homelessness, wildfires, all interconnected, right? You also think about, okay, if the medical devices, if the pharmaceuticals are produced somewhere in the country, and because of climate change with more severe storms, more flooding, if that plant or if that source of medical devices and drugs were to be destroyed, the transportation issues interrupted. So on the West Coast, how are we going to get the pharmaceuticals needed, the medical devices to take care of patients? So all of these are interconnected in this very complex ecosystem of healthcare.
So you have done a lot of work with social determinants of health. Do you count climate change as something put into that bucket as well?
Absolutely. It's really a you know, as opposed to a virtuous cycle, it's a terrible, vicious cycle, because if you look at homelessness and food insecurity, you add to that climate change where there are crop failures. That impacts supply of food, right? When you look at, again, the severe weather that we are experiencing now and people being displaced to homes, it compounds homelessness and housing insecurity, never mind, again, the mental health illness, the loss of lives, all of that stress the system that it's already under tremendous amounts of stress.
This is a dire picture that you've reminded us to think of. What is Kaiser doing to prepare members or to help members get through some of these issues that may come about because of climate change or some of the other social determinants of health that you mentioned?
Yeah, so Kaiser Permanente, as you recall, we are a collection of entities. So there's the Kaiser Foundation Health Plan and hospitals, and then there are the 8 Permanente independent autonomous medical groups. Together, we are knitted by our mission to improve the health of our communities. So as part of that, we invest in community health, whether it's for support housing. So in all our regions, we have contributed millions to organizations, also partnering with other organizations to improve housing, to also increase access to healthier foods, right? So all of that we are committed in investing. At the physician level, some basic things we can do in terms of impacting or helping climate. As a physician, we have video visits, we have telephone visits, so you don't have to be driving around, right, and contributing and increasing the carbon footprint. So that's been shown to decrease that. Another thing is pharmacy. So instead of driving to the pharmacies to get your medications, in KP Northwest, for example, nearly 50% of all prescriptions our patients receive by mail. So it meant, imagine the savings in terms of people's time, energy, and again, carbon emissions from not having to drive everywhere. So simple things like that. The other thing we're doing is really, as physicians, influencing environmentally smart purchasing. Our Permanente anesthesiologists, their leadership in this front have really decreased our use of desflurane, which is a gas that can last in the atmosphere for 10 years. And we've switched to sevoflurane, which is only about a year. So these are the things that physicians can directly impact. The other thing is when you think about facilities, the life of a facility in terms of power use, water use, all of those things, we can work with our business partners, we can work with our vendors in creating environmentally friendly facilities that use less energy, use less water, and all of those things we have now in our particularly gold LEED or platinum LEED hospitals and facilities.
Okay. Kaiser has, and it's this hospital organization that you work for is such a leader, a thought leader on so many fronts. Do you think this message is something that you hope other organizations will also take up the mantle for by setting an example, by talking about these things at our conference?
Right, I hope so, because KP can't do it by itself. It's going to take everybody. It's going to take everybody. It's going to take the entire world to really commit to reducing our carbon footprint, reducing greenhouse gas emissions, committing to environmentally friendly practices, not just in the home. We all talk about recycling and such, but again, where we can think globally and really work locally to impact those things. So awareness, it starts with awareness. This conversation you and I are having, somebody might be watching that didn't even connect the dots about wildfires and the impact on health, that the fact that in Oregon, of the 5 top causes of death, wildfires and the contribution to air pollution increases stroke, cardiovascular disease, respiratory disease. So all of those things contribute.
Now, Dr. Dacones, you had outlined some things that people can do when things are going well. Like, instead of driving to appointments, you could do your appointments virtually. Do you have a plan in place if an emergency were to strike?
Say more.
So, in terms of like wildfires, maybe knocking down power lines and making it hard for members to get to your facilities, what sort of emergency plans might be in place for something like that? A catastrophe,
right?
If you will.
So we've engaged the communities now in doing simulations using our hospitals. So preparedness by the care teams is one thing. And then when you look at it beyond that, it's really preparedness on all levels, at the individual citizen and the citizen's home, but also the government and the agencies coordinating, fire, police, law enforcement, and then creating that. It's just how we did simulations, for example, for Ebola within the hospital. And then how do you do it as a system of hospitals? And beyond that, how do you involve public health in that? So it's the same type of coordination and collaboration that's needed. So absolutely, we're doing simulations for care teams and at the hospital level what to do in such an emergency, because we've seen it. We do see it. With the wildfires in Oregon, we saw more ED visits as people with chronic lung disease in particular were more affected by that and tend to have more asthma attacks or chronic obstructive pulmonary disease exacerbations, we call it.
What other messages are you leaving with attendees at this conference during your visit here this time?
Around climate health,
and what are other messages are you talking about?
Well, this afternoon I'll be talking about workforce strategies on how do you empower interdisciplinary teams and leaders, especially in particular for me, physician leadership and development.
Okay, great. And how are you finding the conference so far this year?
It's overwhelming. There's so many amazing talks to go to, and you can't go to all of them, right? And some of them they're at the same time, so it's triaging what I can go to in the moment.
Yeah. All right, Dr. Dacones, always great to see you.
Yeah, you too. Thank you
so much.
Thank you.
And thank you for tuning in. Stay with us.